So let's talk about the allergens. I think we owe that a little extra like click and double down on.
Yeah,
I had
totally.
we did a like a social media post where we saw a family doing introducing peanut butter at the doctor's office outside, and I have friends who have done this. I couldn't believe it. It's like a real
Hmm.
thing. So it's because
Yep.
there's a real fear that your kids are going to go into anaphylaxis and like need emergency care. So the overwhelming majority are not going. That's not going to happen. But so we're saying introduction at around 6 months should be good. And what like how do you recommend going about that?
Yeah, that's a great question. So, peanut butter is like a total staple at our house. So I can't imagine what I would do if my kids are allergic to it. But I think the best way to introduce it, at 6 months, it's tough because they're not really ready for like a nut butter. So I really like to lean into like the peanut butter powders because you can mix them with water. So like that PB2 powder, which is, it's just like powdered peanut butter, and you just mix it up with water. You can make it really thin and really runny, and you can just kind of like drizzle it over a food that they've already had, like banana or something like that, or applesauce, and just kind of mix it in. And as long as they've been exposed to the food before it, so if you're going to pair it with something, you can just make sure it's a food that they're already tolerating, and then try and drizzle it on or incorporate it frequently. They say early and often is really good. So I like the nut butters, and I think they probably make them for other allergens as well, like other tree nuts. And I think
Mhm.
they do make like even packaged ones for some of those tree nuts that are just thinner that you can use in the same way.
All
Okay.
right, so we got the powder, then the butters, and then there's a risk with the actual nuts, isn't there? Like the
Well,
aspiration
you
risk.
want, yeah, I mean, you want your kid to be able to like chew them effectively. Like I give my 4-year-old some nuts sometimes. He doesn't really like them, but he'll eat them. My 2.5-year-old wants them, and I'm terrified every time. So I honestly would recommend just waiting on the actual nut. I mean, you're going to get that allergen exposure out of the powder anyways, because it's really like the protein that is the allergen. It's not so much like the oil and the fat. And that's the difference. So like these nut powders are really helpful because they're just sort of like the distilled nut protein, without all the oil and fat. And so you're still going to get the benefit of the allergen exposure if you just use like the powder and mix it with some water and drizzle it on.
So what's the difference if you like mix powder, it kind of becomes a pasty butter like consistency? Like why do
Yeah.
you prefer that?
Yeah. You can just make it a little thinner. Like I think sometimes peanut butter itself is so thick and
Mm.
like it's just hard. Like, if you eat a bite of peanut butter sandwich and you take too big of a bite, you can like feel it go all the way down because it's thick. I mean, it really doesn't it's not as forgiving as like a thin nut butter that you can just kind of drizzle or mix into something. Does that make
Okay.
sense?
Yes, that makes a lot of sense. Yeah, totally. And then what
Yeah.
about eggs and other potential allergens?
Yeah. So I think you can expose them as you're ready. I mean, I think obviously like scrambled eggs or something like that are, great. They're easy for kids to grip, to smush, to get into their mouth. I think we get into trouble when we forget about variety. And so I think the most important thing in like preventing allergies is a huge exposure to a variety of foods. So like it's great if people want to introduce egg, you can do it in a baked form or like a cooked form. I think that's fine. Full disclosure, I never did that with my kids and they're not allergic to anything. So if you are a person that's like, I don't like eggs, or your other kid has an allergy to eggs and you aren't able to expose your child or don't want to, it's okay. They're going to get that exposure anyway, eventually. Like my kids go to birthday parties and they stick a cupcake in their mouth, or they want to try a piece of chicken or whatever, and they're completely fine. I think the reason is that they've had a lot of exposure to a lot of variety. And I think we do get into trouble when we kind of lean on a handful of foods only. And that's when we actually are prone to get more allergies. So exposure early and often to a variety of foods is really the key. And you can do it at any time as long as your kid is showing the other signs of readiness. So as long as it's not a choking hazard, they're stable enough, they're going to protect their airway, like you can really offer them some version of whatever you're feeding the rest of the family as long as it's a safe for them to try.